The capstone course in the health analytics program is the grand finale course that students take before graduation to be ready for a much more of an applied real-world experience. So how do they take the things that they've learned, work with a real sponsor, with perhaps their employers or with other external organizations, or we have some partnerships that we've been working on within the Northwestern University community. The significance of health analytics has never been greater than before. We've generated more data in the last 2 years since record keeping began. We think about all of our pharmacy systems, our lab systems, our claims data sets, how we're working through prescriptions and order entry, etc. This has all been digitized, and the real end game here is not just to go through a digital transformation, but ultimately, how do we derive and maximize the value of the data that has been collected or is going to be collected in the future, so that we can not only have better treatment decisions, how do we move towards that precision medicine concept of the right treatment for the right patient at the right time, and how can we be more operationally efficient, how we can drive that operational excellence. And when we think about data, it can serve you in many different ways. One is if you just wanted to understand what is happening, to get our arms wrapped around why are we seeing so many patients coming back to the emergency room. But if we wanted to go a step further and start predicting which patients do we think are going to be ending up in the emergency room, and how can we proactively start managing those patients instead of waiting for these events to happen and then being more reactive. So how do we move towards a more proactive culture? And hopefully, as we advance further, how can we understand what should be done? What is the next best action? How can we be even prescriptive in our analytics? That's understanding what is happening in our health systems. We like to maximize the experience that students can get in the entire spectrum of the data journey. So first and foremost, it's important to understand what problem are the students solving, right, for the sponsors. So understanding what are those business questions, what are the research questions of interest. And then once there's a good understanding of what those project goals are, what the problem statement is, then you think about the data journey from identifying what is the right data set to be able to answer those questions. It's very rare in the real world that you get a very clean and pristine data set. So that experience of going through the data cleaning, the data management process, to get it ready for them to do the data modeling and to be able to do some of that predictive or that machine learning and things that students get really excited about. It's being able to create a story and be able to discuss that and share that with different stakeholders, and how this informs their strategies, how this informs the different programs, and how we can drive better decisions, right, for improving the delivery of care. I think the outcomes both for our students and for our sponsors couldn't have been better. They can make a real impact through the analytical techniques that they've learned, through the leadership skills that they've developed, through the programming that they've been working on, and those experiences are pretty transformational for our students in their program.